Okay, so I'm first gonna do my brief head to toe. Alright, so I've gathered my equipment. I have my stethoscope, I have my pen light, an alcohol wipe, but before I enter the room, I have cleaned my equipment, gathered my equipment. It's clean. Alright, come in. Hi, my name is Haley. I'm a student nurse at the Denver College of Nursing. I've come in here to do a brief head to toe for you. This is a good time? Yes? Okay, awesome. I scanned the room as I was walking in and I didn't see any hazards or anything, and my patient doesn't look like she's in distress. I'm going to close the curtain, wash my hands. Could you tell me your first and last name and your date of birth? Awesome, thank you. Alright, so we'll get started. So, just going to start out by looking at her general appearance. I'm trying to do this off of memory. Okay, so the patient is obviously awake. She's conscious. She's making good eye contact with me. Her mood seems content and happy. Her speech is normal. It's not slurry. I don't see any, like, her face isn't drooping or anything like that. Just looking at her overall appearance, she looks clean, good hygiene. Her hair is clean, clothes are clean, and her hair looks clean and washed, and her breathing looks unlabored. Okay, so then I'm going to test level of consciousness. So she already told me her name, so I don't need to ask her name again. Now I'm going to ask, do you know where you are today? Do you know what date it is? And why did you visit us today? So she answered all of those questions correctly, so she's alert and oriented times 4. Okay, now I'm going to assess for facial symmetry. So I'm going to ask the patient to smile, frown, puff their cheeks, and raise their eyebrows. So the facial expressions were symmetric on both sides. I didn't see any drooping or anything like that. So cranial nerve 7 is intact. Okay, so now I'm going to look at the pupils. Yep. Holding this up to the eye, or this way. Holding this up to the eye, they're about 4 or 5 is the normal range for your pupil size. They're round, they're brown, or black. They're round, they're black. Okay. And then I'm just going to shine this light in your eye. If you can just stare straight ahead for me, and then just look straight ahead, and I'm going to bring this light in your eye. So I'm going to bring it, and the pupil constricted, and then I'm going to do it again. So pupil constricted on this side, and it was consensual because I saw it constrict in the other eye. And then I'm going to test it on this side. Pupil constricted, let it dilate for a second. And I saw it constrict on the other side as well. The last thing I'm going to ask you to do is to stare at this pen for me, and I'm going to bring it close to your nose. So just keep staring at the pen. Okay, so I noticed that the eyes converged. I didn't see an nystagmus or strabismus. So pleura is intact, so pupils are equal, round, reactive to light, and accommodating. Okay. Alright, so hearing is intact because you've been able to have a conversation with me this whole time. Now I'm going to assess for your mouth. So just pretending it's not on this. Lips are pink. I don't see any cuts in the lips or anything like that. Looking inside the mouth, so I'd ask the patient if they could open their mouth for me. I'll go, so I don't see any lesions on the tonsils or anything. Gums are pink, teeth are white. I don't see any chipped or broken teeth or anything like that. No lesions or trauma on the tongue. and the mouth is moist. Okay, so now I'm going to assess for skin triggers. So if the patient had a gown on, I would just ask them to pull it down a little bit. I'm going to go right here, and I can do it at the same time. Pinch, and if it goes down pretty quick, that means good skin elasticity bilaterally. Okay, so then I'm going to raise the patient I'm going to raise the patient into a semi-Fowler's position, or I'm just going to have them keep sitting like this right here with me. So looking at the patient's chest, AP to transverse is 1 to 2. Chest is symmetric. I don't see any accessory muscle use. And then now I'm going to auscultate for breath sounds. My stethoscope is cleaned. I cleaned it with a alcohol wipe. I'm just going to do this on myself. It's easier that way. Alright, so I'm going to be listening with the diaphragm, and I'm going to listen. I'm going to lower the gown because I listen right on the chest. I'm going to listen here. I actually don't know what, oh no, I'm going to listen here. And ask the patient to take a deep breath. So after listening to the lung sounds, I listen here, 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 and here. They were clear and equal bilaterally, and I didn't hear any crackles or any adventitious sounds. I do the same thing on the back. I can't really do that. But you go here, like above the clavicle, or above the scapula, and then you go like in between. So like here, like a sports bra, follow the sports bra line. And you go back and forth for that. And I would say also clear and equal sounds are heard posteriorly. I didn't hear any crackles or wheezes bilaterally. Okay, so now I'm going to be doing cardiac. So for cardiac, ideally the patient should be in supine. So probably at this time I'm going to ask the patient, probably for respiratory, I'm going to want her to sit like this. And then for after respiratory, I'm going to ask them to lay down, and get all the way down in supine position, and then when she's comfortable laying down, I'll raise the head of the bed because I don't want to hurt my back. So first, pull down the gown, just look at the chest. I don't see any heaves at the point of maximal impulse, and now I'm going to auscultate using the diaphragm. So I'll just pretend I have my stethoscope. So I'm going to be using the diaphragm. My stethoscope's clean. So first, this is my right side. So first I'm going to be listening right about here. So first I'm going to listen to aortic, second intercostal. Second intercostal space, right sternal border. And then I'm going to slide over, still on the sternum. Get right about there. So now I'm at left intercostal space, or second intercostal space, left sternal border, and I'm listening to pulmonic. And I'm gonna move down a little. Third intercostal space, this is Erb's point. Fourth intercostal space, this is tricuspid, and then going above the gown, I guess, about right here. So this is fifth intercostal space, left midclavicular line, and I'm listening to the mitral. And I want to report that I heard S1 louder at the apex, and I heard S2 louder at the base. So make sure that's right. Yep. And rhythm was regular. I didn't hear any murmurs. Okay, so now that's it for cardiac. Yep. Alright, so now looking for GI, I'm just going to ask you some questions. When was your last bowel movement? Okay, and did you have any constipation or pain with that last bowel movement? Okay, and in terms of urination, do you have any problems with frequency, pain, or burning when you urinate? Okay, perfect. Yeah, okay. So I knocked 2 of those out. So now I'm going to ask the patient to lift up their gown. Well, I'm going to lift up the gown and pull the blanket up so it's like this. Looking at the stomach, it's either going to be scaphoid or flat. Those are normal. Okay. Then I inspected, now I'm going to auscultate in each of the quadrants. So I'll just do it on myself. So starting right side, starting in the right lower quadrant, or right upper? No, right lower. Okay, right. Oh no. Yeah, right lower. Okay, starting in the right lower quadrant, I'm gonna listen and say I heard bowel sounds. Heard bowel sounds. Well, here, probably down. Heard bowel sounds. Heard bowel sounds. Heard bowel sounds. Heard bowel sounds. So I heard bowel sounds throughout. I heard about 5 to 30 bowel sounds per minute, and they were normal active bowel sounds. Okay, so I auscultated. Now I'm going to palpate. So starting in this quadrant, I'm going just to palpate around. Right, upper, left, lower. While palpating, the patient didn't have any tenderness and I didn't feel any masses. Okay, and that's it for that. And then we'll go up to the skin. So looking at the skin and the upper extremities, skin color is appropriate for genetic background. I don't see any lesions, no trauma, no skin breakdown at the bony prominences. Yeah, I think that's good for that. Integrity. Skin color, no redness, no skin breakdown. Size and shape is equal bilaterally. Okay, and then I'm going to check for edema. So palpate around here, palpate here, palpate here, palpate here. So that's edema for the upper extremities. Then I'm going to palpate. I'm going to do cap refill. So hold down for 5, let go. Skin color comes back in less than 2 seconds. So good cap refill. Then I'm going to check for temperature using the back of my hand. So boop, 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 like this. Skin temperature is warm. What else? I think that's it. And she doesn't look cyanotic. Oh yeah, checking the pulses. So for the upper extremities, I'm going to check the radial. So it's 2+ bilaterally with regular rhythm. Then looking at the lower extremities, or no, sorry. I'm going to do musculoneuro for the top now. So I'm going to be assessing for muscular strength for the top upper extremities. So I'm only doing this, and hand grips, I think. Is that right? I can't remember which ones exactly I'm doing. See, I have all of them in here. I don't think I'm supposed to. So you're going to ask the patient to flex their arm while you're pushing against it. And then you're gonna do the opposite. And then you're gonna do hand grips. Okay, so muscular strength for the upper extremities is 5 out of 5 bilaterally. Okay, and then for neuro, I'm just gonna use my finger actually. I'm gonna have the patient close her eyes, and then I'm just gonna go like this. Say yes when you feel my finger. She's gonna say yes when she feels my finger. Okay, and then I'm moving on to the lower extremities. Skin color is appropriate for genetic background. I don't see any cyanosis, doesn't look blue or anything. I don't see any trauma to the legs. I'm going to assess for size and shape of the lower extremities is equal bilaterally, or they're symmetric. Okay, and then I'm going to check for edema, so I'm going to go here and here, and on this side, here and here. And I'm going to do cap refill, push down for 5, it comes back in less than 2 seconds, so good cap refill. Check for temperature. Lower extremities are warm bilaterally. Then I'm going to check pulses. So I'm going to do the, I guess I should take myself out. Going to check the posterior tibialis, which is in here somewhere. And then I'm going to do the dorsalis pedis. I don't know where it is on that side. Posterior tibialis, dorsalis medius. 2+ bilaterally with regular rhythm. Then I'm going to check for muscular strength in the lower extremities. So what I'm going to do is I'm going to have the patient flex, which is testing their hamstrings, and then extend. And then I'm going to do it on the feet too. I'm going to ask them to point their toes to the sky and then push their toes to the ground against resistance. So muscular strength is 5 out of 5 bilaterally. Then I'm going to check sensation. So I'm just going to ask them to say yes when they feel my finger. Yes, 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 yes. So sensation is good or intact bilaterally for the lower extremities. Okay, all right, we are all set. Thank you so much. Here is your bedside table. Here's your water. Here's your call bell. Bed is all the way down. Head is all the way down. Bed is low and it is locked. Call bell is in reach. Do you have any questions for me? All right. If you need anything, hit that call bell and we will come in. Okay. All right. Would you like your door open or closed? Open. Okay. So I'm gonna open the curtain and then wash my hands. And that is it for the brief head to toe.